and quickly introduce myself and our Associate Director, Ali Mirzazadeh, who's here with us today. My name is Elizabeth Fair. I have been the Program Director of this PhD program for 6 years now. My faculty appointment at UCSF is in the Department of Medicine. My training is in infectious disease epidemiology. That's where I got my PhD in, and in public health. All of my training was done in the United States. I've been working in global health for, I hate to say it, more than 25 years. And most of my research focuses on tuberculosis in high burden settings, mostly in Eastern Africa and Southeast Asia. So Ali, would you like to introduce yourself?
Yeah, of course. And I want to say hi, everyone, and welcome to this info session. My name is Ali Mirzazadeh, and I'm in this program working with Elizabeth and the team for, I think, about 5 years. And I came to UCSF about 11 years ago, and I born and educated in Iran for a PhD in epidemiology and public health. And my research specialty focuses on sampling hard to reach population, like injection drug users, and then find how many they are, where they're located, and how is their access to the services that we want to know. My primary focus would be research on low and income countries, including Afghanistan, Iran, some countries in Africa, and Vietnam.
Great, thanks, Ali. A very introductory slide we have here. Where's UCSF? We appreciate a lot of people applying to our program are not in the United States, have not been to the United States before. So this is our very cursory map. United States, California is on the West Coast, San Francisco, Northern California. And this picture that you see on the slide and behind me in my virtual background is the Golden Gate Bridge, which is one of the more iconic images in the United States, really, and in the world. And just to say, San Francisco is a beautiful city. It's a fantastic place to be a student and get to explore. A little bit more about the University of California, San Francisco, UCSF. It's a graduate school campus. So there's 4 professional schools at UCSF, a school of medicine, a school of nursing, a school of pharmacy, a school of dentistry. All of these schools are highly rated in the United States. In addition to that, there's the graduate division, which is the umbrella for all of the PhD and master's programs. So that's where our program sits, is under the graduate division. There's 19 other PhD programs that UCSF offers and 11 master's programs. You can see here on the map on the right, this is San Francisco, and each of these little blue bubbles are different UCSF campuses. So we are spread out across the city. This Parnassus Heights campus is one of the larger campuses that has the medical school, most of the professional schools. Over here on the right is the Mission Bay campus, where the Institute for Global Health Sciences is based. But all of this is just say that UCSF has a really large and robust student body. There's over 3,000 students at UCSF. More than 1,700 residents, clinical residents and fellows, over 1,000 postdoctoral scholars who are, after doing their PhD, stick around or come to UCSF to continue their research. And more than 90 countries are represented by our student body. Related to that, we do have a really robust international student presence in all of the schools. Specifically in this PhD program, about half of our students come from outside of the United States. And so in support of that, we have a fantastic international students and scholars office that works really closely with our international students with help with immigration, visas, just moving to the United States, et cetera. So we work very closely with them and rely on them for information, as a lot of this policies, as you all know, change over the years. In addition, we do have student housing at the Mission Bay campus and a few of the other campuses, but for some students, that's a real bonus to if you're relocating to San Francisco for the first time. Narrowing in, this is Mission Hall. This is at the Mission Bay campus. This is where the Institute, this is the building that houses both the Institute for Global Health Sciences on the 3rd floor and the Department of Epidemiology and Biostats on the 2nd floor, which also has a PhD program. And there's a lot of faculty that go between the 2 floors, students that go between the 2 floors. So it's a great community of global health research and applied research in this one setting. So why study at the Institute for Global Health Sciences? This is a quick snapshot on IGHS, as we call it. It was founded in 2003 by Dr. Haile DeBoss, who was the former chancellor of UCSF, as well as the dean of the medical school. We now have more than 350 faculty and staff in the Institute for Global Health Sciences. In addition to the smaller PhD program, we have a larger master's degree program. That's a 1-year global health master's degree. So there's around 45 students, whether across the master's and PhD program at a time, that really are important pieces of our research and community. The countries in which IGHS work is more than 50. Global health sciences is in all of the global health work. There's a lot more that goes on across UCSF, and more than 144 at last count. This is obviously a dynamic number of countries are represented by the research and collaborations that UCSF is involved in, and over 1,000 UCSF investigators working in global health. You can see on the right here sort of some of the major focuses of the Institute for Global Health Sciences: diplomacy and advocacy, some of the more traditional infectious diseases, HIV, TB, malaria, but we also have more methods-based, like measurement and evaluation, health financing, et cetera. So there's a real broad swath of global health topics and areas that people are working on, both sort of operationally and in terms of applied research in the Institute for Global Health Sciences. So what's exciting about the PhD program? So there's a couple of things. One is we're a young program. We're a relatively small program compared to others. And because of that, we have some nimbleness and some flexibility, and we like to think that we're innovative. We're constantly sort of evaluating what we're doing and considering whether it is the right thing and how we can mature and evolve. So the program was launched in 2016. This cohort that you all would be applying for is the 5th cohort that would be matriculating in 2023. We accept students every other year. So as you can see, it's mostly on the odd years. We're one of the only doctoral programs focused specifically on global health sciences. And as I said, we're a small tailored program, usually 4 or 5 students per cohort. I put this slide in here just as this is a picture of some of the actually cross cohort activities. This actually has cohort 2, cohort 3, and cohort 4 students together on one of the activities. I think they're at the Cal Academy of Sciences for an evening out, but just to remind me to share, we really value building community amongst the cohorts of students and between the cohorts of students, and really firmly believe students learn more from each other being in the trenches together, and some become lifelong colleagues than learning from the faculty in your classes. So we really like to support the peer engagement within cohorts. So a little bit into the details. I'm going to touch a little bit on coursework, mentorship, and research practice. So in terms of coursework, this slide shows the required courses for all PhD students in the Global Health PhD program. So I know this is a very busy slide, but I'll break it down simply for you. Students are expected to take courses over the first 2 years in the program. So in the fall, winter, and spring quarters, we're on a quarter system for year 1 and year 2. In the summer, between year 1 and year 2, students do not need to enroll in classes, can do whatever they want, can work on a research rotation, which I'll talk about a little bit later, but do not need to be a registered student. This top line here describes our Global Health Pro Seminars, which are a seminar series we developed that's 6 quarters long and really is the global health content of the program. So as you can see here, we start with global health development, history and inequity. It's sort of the big macro picture on global health context. We have a course on global health policy, on health systems and financing, global health diplomacy and architecture, economics, and then the final one is global health research practice and ethics. That's really getting into the sort of how-to, ethics, IRB, et cetera. In addition to this pro seminar, so students take one every quarter, we also have a global health doctoral seminar that is led by myself and Ali, who you met. And really this also builds sort of as you go through the program. So the first couple quarters really is an introduction to the program, guest speakers, academic planning, et cetera. We have a focus on methods in the first year. And then a couple of different specific global health topics, such as decolonizing global health, which is a really important question that has really evolved over the last few years. And we dig into some of these big decolonizing global health questions with the students. But important themes through doctoral seminar in year 1, we work with all the students to what we call write a year 1 paper. So acknowledging the fact that the dissertation for PhD students, the form of that is 3 publishable papers. Some students come in with a lot of publishing history, some have never published a paper before. And so we really work closely with the students in year 1 to publish a paper before the pressure of doing your own independent paper for your dissertation. So it focuses on scientific writing, on data analysis, et cetera. Similarly, in year 2, like the year 1 paper, we focus on grant writing. And so we work closely both to give sort of the didactic skills on how to write a grant, but also really practically to help students apply for funding, for their own independent funding, which both helps them finance their research, their tuition, et cetera, but also is just a really great skill to come out of a PhD program, both with the skill and ideally having your own funded research as something that's on your CV and an accomplishment within the program. So in addition to these global health programs that are in yellow, this is a research degree, a research PhD. So we want to make sure all students have sort of really foundational methods to conduct global health research. So this includes at least 2 epidemiology classes, at least 2 biostatistics classes, at least 1 implementation science class. Some students choose to take, there's a series of 6 implementation science classes that they then get a certificate in implementation science, but at least 1 is required for our program, and some qualitative and mixed methods classes, as well as systematic review. And then in addition to these required classes, we really work closely, and academic advisors work closely with students to help tailor elective classes to fill in what students need to accomplish the research that they're setting out to do in their own independent research in their dissertation. So some choose to do more anthropologic sciences, some choose to do more health policy, some really focus on qualitative methods, quantitative methods. So there's a lot of options. As I was talking about before, the UCSF has for professional schools, so you can take classes in other schools. We also have a intercampus exchange program, so students can take classes at University of California, Berkeley, which is just across the bay from UCSF and has a school of public health and a lot of other programs that UCSF does not have. So there's really a rich academic environment to choose from to build out your own academic portfolio and your own curriculum. So next, I wanted to talk a little bit about mentorship. We're huge champions of mentorship and believe both in peer mentorship, faculty mentorship, and creating those networking opportunities for students within the program. So I want to talk a little bit about the faculty advising. Each student in our program, when they come into the program, is assigned an academic advisor who really is the person who they work closely with, particularly in those first 2 years of the program, while they're figuring out what curriculum they want to take, what classes they want to take in addition to the required classes. Typically, towards somewhere in year 2, students start identifying who their research advisor is going to be, and that's the person who they're going to work more closely with for their independent research for the years 3 and 4 when they're conducting their dissertation research. Both the academic advisor and the research advisor become 2 of the 4 members of each student's doctoral committee, which is 4 faculty members who really get to know each student really well, support them in their sort of pathway through the PhD program, and are the people who ultimately sit on the qualifying exam committee and the dissertation committee for students, but they're a really core sort of nucleus of support for each individual student. So next, I want to talk just a little bit about research practice. We don't believe all of the learning happens in the classroom, in didactic practice. We want students to have applied research experience and a diversity of research experiences while they're still sort of have the opportunity to put on their student hat. So all students are required to do 2 research rotations in the first 2 years in the program. And there's a couple different reasons and ways that this can look for students. So the very traditional model of a research rotation is for a student to choose a faculty member that they're interested in working with. Perhaps they want to try out working with someone to see if their research portfolio or research interests are aligned, and maybe that's someone who might become their research advisor. So it's a way to sort of do an apprenticeship or a rotation with one faculty advisor to get to know them better. Another purpose of this is really to have the opportunity to do some research and experiment in areas that is something that students don't know anything about. So some students come in and say they're very interested in infectious disease. We would encourage them to maybe do a research rotation on someone who's doing research in health policy or in non-communicable diseases, and really just to get that sort of opportunity to get a broader breadth of global health experience. And the third exciting sort of way a research rotation can be structured is opportunities to work outside of academia or with other partners. Typically, if someone wants to do a rotation outside of UCSF, it happens in that summer between year 1 and year 2. And we've had students apply for summer internships at WHO, at CDC, at Gates Foundation, World Bank. So it's really exciting. Some students just want to sort of, it's a wonderful way to say, I'm a student, I just have this limited amount of time, but I want to get some experience. It's low risk, and if a good connection is made, sometimes it leads to longer term networking and connections for students. So that's really exciting to see when it comes to fruition. The second requirement are teaching residencies, which typically students do this in the 3rd and 4th year. And really, the 2 purposes for this: one is to really start getting some skills in teaching. Many people come in to do a PhD because they're interested in a path in academia, and so it's a good opportunity to work with a student, work with a faculty member, have an opportunity to organize a course, to give a couple lectures in a course, really see if that is something that students are interested in or not. Another wonderful sort of side benefit of this is, say there's a course that you really loved, you can volunteer to be a teaching assistant in that course, and it really codifies that knowledge in that one area and working with that faculty. So this slide shows just some of the examples of our student-driven research. So just to go through a few, what I find really exciting about our program is the diversity of research interests, research areas, the way people approach what they want to do in terms of global health research. So we have one student who's doing One Health research on pandemic response across animals, environment, plant, and human sectors in Uganda. And this student their first paper for their dissertation, wrote a scoping review about timeliness metrics on outbreak response. And after doing this, went to Uganda and was working with close colleagues there to start trying to operationalize some of these timeliness metrics in outbreak response. And then the third paper would be looking at a couple specific outbreaks and seeing how well it did. We have another student who's interested in malaria, geospatial research in malaria elimination, and is doing 3 different papers from 3 different country contexts, looking at different methodologies for assessing malaria elimination. Finally, in terms of an example, we also have a student who actually just graduated who did qualitative and anthropologic research on socioeconomic drivers of poor obstetric care in California. So not all of the research that our students do has to be international. This was in vulnerable populations and different populations in California. So you can read the rest of these if you're interested in seeing more. Our website actually has a little bio of all of our students, both current and alums, and the type of research they do. So I encourage you to look those up to just get a sense of the type of research students are doing. A quick slide on progression milestones. As I said, this is structured as a 4-year program. Typically, the first 2 years are doing coursework, completing the core curriculum, completing research rotations. After 2 years, all of the PhD students, they form their doctoral committee, they sit for a written and an oral qualifying exam and defend their dissertation proposal to their doctoral committee that I talked about earlier. And then really the second 2 years of the program are independent dissertation research. We certainly find ways to keep students engaged and connected in those 2 years, but really a lot of students who are not from the Bay Area or from the United States choose to go back to the country they came from before and continue doing their research there. Some choose to stay at the UCSF for the full 4 years. The residency requirement is really only for the first 2 years in the program, and the second 2 years can be structured much more flexibly depending on what kind of research students choose to embark on. So a couple FAQs before we open up for your own questions. The number 1 question we get is how to pay for this PhD program, financing your education. So to put it sort of broadly, admitted students are eligible for tuition support and stipend. And we work individually with students to sort this out. But typically the first 2 years of the program are covered by the PhD program. And then we work very closely with students to write grants, as I talked about earlier, to really ideally get funded for all 4 years of the program. So we give a lot of thought and effort and work with our students to cover the funding. The second bullet, you can see over the last 4 years, students have received a lot of different kinds of fellowships, scholarships, grants, etc. So our students have been quite successful in getting securing their own independent funding, which, as I said earlier, is both great to have the funding and is also great. It looks good on a CV to show that sort of independent ability to get research awards, fellowships, etc. A quick slide about the admissions process. Hopefully, if you have made it this far and are participating in this information session, you've read the website. Hopefully this is all straightforward in terms of transcripts, letters of rec, CVs, statements of purpose, etc. The timeline, the application deadline is December 15th. We will invite people for interviews in January 2023. All interviews will be done on Zoom. And we aim to have our decision and offers out late February, early March, depending on the number of applications we get. But that is our ideal timeline that we're aiming for. So this is my final slide, just on application advice. So the first piece of advice I have for everyone applying is read about faculty members, read about research groups and research initiatives at UCSF in the areas that you're interested in, and really critically look at the research and people who are doing that research to see if you think it's a good fit. If you're really inspired by these people, that's fantastic. We want to make sure that students who come into our program have the support, have the research infrastructure that they can participate in. Tell us which faculty and research groups you would be most excited to work with. And if you think it's appropriate, you can reach out to them. If you're not sure or not ready to reach out to them, put it in your application. There's a spot in the application to say who do you think you want to work with, and then we can actually, from that sort of back end, talk to faculty, see if they're taking PhD students, etc. And finally, in your statement of purpose, providing the clearest sense of who you are and why this program specifically is a good match for your interest really helps us determine whether it's a good match. As I said before, we want to make sure we admit students who are who are a good fit for the research that we're doing at UCSF. That will be the best fit for you. And not all programs are the best fit. And so hopefully in looking at different programs, some speak to you more than others in terms of the potential research opportunities, potential faculty to work with, etc. So we could stop the recording now.